morning. I would like to share with you the strategy we take to enhance treatment and prevention implementation in China. This full picture just tell us the Chinese government continuing to committed to fight against HIV/AIDS. It's a newly elected president, and he visited the methadone clinic, and also it's our new premier. Early this year, we have more evidence to show treatment as a prevention in the African country. For the ART coverage, reached 30 to 40% compared with community ART coverage less than 10%. The incidence in the community reduced by 38%. What it exactly means treatment as prevention? In order to achieve that goal, there are at least two requirements. The requirement number one, most of HIV-infected individuals know they are infected. How to achieve that? That we need a vigorous testing program to have them be tested, identified. The second requirement, most of HIV-infected individuals receive ART and have achieved viral suppression. Since 2004, we launched vigorous HIV testing campaign, and each year we identified huge amount of people being infected. Unfortunately, even we have very active testing campaign, however, among newly identified HIV cases, most of them already infected for many years. If we look at the CD4 level, among newly identified, more than 60% already infected 5 years. That means testing campaign is not that effectively to identify most of the people infected. The most important to have these unidentified to be tested because they are major driving force for new infection. To meet with the challenge, Chinese government issued new policy that called Simplify 5 Expansion. Among that 5 expansion, testing and treatment are 2 of them. What strategy we use to enhance treatment and prevention? First, we preset target for how many people being identified, how many people being newly put in the ART. The second strategy we used, test and treat for specific targeted area and for specific groups. Let's look at the first strategy. We use this new strategy started from 2011. At the beginning of the year, we set our target. Countrywide, we needed to identify 75 HIV new infection. By the end of the year, we achieved 99%. And at the beginning of the year, we set a target. We must provide treatment for over 40,000 of patients. And we did even better. We achieved 114%. Last year, we even increased our target. At the beginning of the year, we set a target. We must identify 77,500 new cases. And we did that better compared with previous year, achieved 105%. For HIV for ART treatment, we set a target 46,000, and we did 55,000, 121%. What about this year? If we look at HIV testing in the previous years, if we look at just past 2 years, in the 2011, we have 84 million of people being tested. We identified 74,517 cases. Last year, we have 101 million of people being tested. What does that mean? That's about 3 times of Canadian population. That is 1/3 of American population. That's 8% of China population. We identified 82,434 cases. For treatment, in the past 2 years, and we have significant increase. What about this year? We have annual meeting at the beginning of this year. We even set ambitious target. This year, we try to identify 87,000 of new cases. And we provide treatment for 62,000 of AIDS patients. We are confident to achieve that. The second strategy is test and treat for targeted group and for targeted area. With support from the Chinese government, we call it mega research project. Test and treat strategy targeted in the 5 areas that is red dot. You can see in the 5 provinces. Each of area targeting about 1 million of population. For that area, people need to have at least once a time tested for HIV. And once they identify HIV positive, encourage them for ART. The second targeted group is discordant couple. So we selected high infected area, total 40 counties. That covers almost about 2,000 discordant couple. So it's a randomized trial. So we still have tremendous resistance for providing treatment for people at early stage, that including resistance from doctors and resistance from people infected themselves. So we try to use, we call it social marketing strategy to promote the treatment as a prevention and test and treat. The third target area group is men have sex with men. That's a tremendous challenge we face. It's the only group have continuing increased epidemic. We selected total 16 cities. We selected 8 cities as intervention city, that including Beijing, Shanghai, large cities. The total population size for that 8 city is about 100 million of total population, but we only target men have sex with men. So we use the strategy repeated test. For men have sex with men who are negative, at least twice a year for HIV test. Once they test HIV positive, we provide ART. The total population for men have sex with men in these 8 cities is about 500,000 to 800,000. So the study is ongoing. In terms of language, treatment and prevention is a more scientific language. As an implementator, I do prefer test and treat. It's more acceptable to people who are targeted. Thank you for your attention.